Hey guys, we're going to get started in just a couple minutes. We'll just give people a couple more minutes to roll in. Hi, Melissa.
Hi.
Okay. Share screen. I want to make sure I've got Q&A open in the chat. Okay. Share this screen. And I'm going to just wait 2 seconds to share my screen so that way I can see how many people are here. All right. Good. Okay, we've got a few, so might as well we'll get started here. All right, so we are here today to talk about fertility, the other half, male factor fertility. My name is Dr. Ashlyn Lanigan. I've been a naturopathic doctor now for over 8 years, and my area of focus is women's health and fertility. In particular, I prefer to treat women, which is why, although I should, just in case any of my male patients are watching, I do have a select number of male patients that I treat who are they're very few and far between, and it's because I love them and they're my exceptions to the rule. But in general, I refer most of the men that come in to see me to our other naturopathic doctor, who's Melissa Dakota. I'm going to introduce her a bit in a second. So yes, as I mentioned, I'm a naturopathic doctor. My focus is women's health and fertility. I also started Flourish, which is a physical clinic, multidisciplinary clinic, which is hopefully opening sometime in the middle of June, as soon as it is safe to do so. And our online hub for women's health is also launching early to mid-June as well too. So we're super excited about that. I live in Toronto with my 2 little humans, my hubby and our dog, and we have another baby on the way. So it's a busy, amazing house. So yeah, I love it. So without further ado, I'm going to introduce you to our main speaker tonight, so Dr. Melissa Dakota. So Melissa has covered both of my maternity leaves, so I know her very well. She's treated many of you on this webinar right now while I was on maternity leave, which is so wonderful. So she's so great, and she's also going to be joining the team at Flourish, which is really exciting, and her niche at Flourish is everything men's health, and I'll let her talk about her other niches as well too. So you go for it, Mel.
Thanks, Ashlyn. Excited to be here. So as Ashlyn said, my name is Melissa, a naturopathic doctor in Toronto, soon to be at Flourish. Pretty exciting. Right now, I'm just practicing virtually until that opens in June. But just to know a little bit about me, I'm very passionate about, sorry, about empowering my patients to take control of their health. So I really think of myself as more as a guide in your health journey and just kind of helping you along the way, because it's really the patient that does a lot of the work, and I'm always amazed with how much patients can do for their health. And I really like to bring things back to basics, so I like to focus on diet, lifestyle, optimizing daily habits so that you can reach your health goals in like a sustainable way. And in my practice, I do see a lot of patients and help them a lot with increasing energy, optimizing sleep, skin health is a big one, and of course, male fertility and men's health in general. So it's why I'm really excited to be here to talk about male fertility.
Amazing. Sorry, I just had to check one quick thing there. Sorry, we're back. Okay, great. Mel, can you see, is my video up?
Can I see you?
Yeah.
I can see both of us.
Okay, great. I can't see me for whatever reason, but as long as you can see me, then others can see me too. So that's fine. Okay, so this is what we're going to go over today. So we're going to talk about male infertility, the optimal diet for optimizing male fertility, some natural treatment options. So I know many of you may be with a fertility clinic right now, which is great, and they may be doing more conventional or medical options for enhancing male fertility, or even certain procedures in terms of optimizing sperm quality. But what we're going to talk about is more like what you can do in terms of supplements and lifestyle and diet and all of those things to really enhance sperm quality and male fertility. So Melissa's going to talk about some factors that affect male fertility, especially lifestyle factors. And we'll definitely leave some time for questions at the end. But that being said, if you have questions, I'll keep an eye on the chat. So feel free just to pop your questions into either the Q&A or the chat. I'll keep an eye on it at any time. And then we do have bonuses for attending live, as always. So everyone will get, I'll send an email after this webinar, which will give you access to our private Flourish Females Facebook group. And so I know I've definitely been a bit negligent with this group so far, but my idea behind it, and it is going to be amazing, is we're going to post lots of content to the group. We're going to upload all of these webinars as well. It's just a way that you'll be able to ask questions. And then my idea behind it as well too was to create community. After I had my first baby, I realized how important it was to be able to be around, or at least communicate with, women that were going through the same thing, to ask questions, to see what's working for people, all of those things. So this is my idea behind Flourish Females. So, and it is a private group. So yeah, which is nice. So you can ask anything, essentially. You'll get access to the recorded webinar. So I had a good laugh with Melissa and actually my husband about this before, which I was like, every single person that is signed up for this webinar is a woman, which I think is hilarious and is also just representative of our sex, and also of, I feel like, generally my patients, I call them power mamas, because they're often working, or they've got multiple kids at home and they're like managing all of these different, like juggling all these different balls. And so I always refer to them as power mamas. So, which is many of you on this webinar right now. And also some of us are power mamas to be, which is exciting. So anyways, hilarious that we're doing a webinar on male fertility to completely women. Dr. Melissa has graciously offered to do free discovery calls with anyone who's interested. So I'll as well send out a link in the email afterwards that you can book that. So it's a 15-minute call. You can ask her anything, and she can kind of give you her 2 cents about it. And then we also have our favorite male fertility supplement. What I love about it, and we'll talk about it at the end too, is that it has almost everything in one pill. When we had our first baby, this supplement didn't exist, and my husband had his zinc and his selenium and his CoQ10 and his omega and like his 9 million pills on the counter every day. And so it's really nice that it's in one, because as much as this is totally generalizing against men, I'm sorry, but sometimes they're a bit lazy and they don't necessarily want to follow a long supplement regime. So yeah, so what we're gonna do is at the end, Melissa's got a great question. So listen up and pay attention during the webinar, and then whoever answers it first in the chat, we will mail you or drop you off, depending where you live, that supplement. So this is our game plan for this evening. We're going to talk about male fertility, optimal diet, natural treatment options, factors that can affect male fertility, lifestyle factors, and then leave time for questions. I feel like I did that slide already. I did. Okay, good. Great. Okay. All right, go for it, Mel.
Okay, thanks. So I wanted to start off going over a few numbers, because I find when people think of fertility, preparing the body for fertility, they immediately just think of women preparing their body for pregnancy, which is totally fine. That's very true. But when it comes to, the 1 in 6 couples in Canada experiencing infertility, which is a lot, 30% of the time it can be due to male factors, 20% of the time it can be due to both female and male factors. So that means about 50% of the time it can be related to the male partner. So it really sheds a light on why it's important to look at male fertility, and just optimizing it in general. Oops. I'm so used to changing the slides myself, I keep pressing enter. Okay, so let's talk about a few factors that can affect male fertility. So I want to go over 4. There's multiple reasons, but kind of the main one, 80% of all male factor infertility can be related to defects in spermatogenesis. So that means sperm production. And that can be affected by so many factors: lifestyle, diet, which we'll go over. And then another factor can be not just production of sperm, but then the transport. So there's something happening in that it's not being transported out properly. And again, there's many reasons for this: past infections, structural issues with the male reproductive system. So that's about 5% of male infertility. And then hormonal imbalances, systemic illness can also have an effect on sperm health. That's a lesser percentage, around 2 to 5% will actually have an effect on male fertility. And then the last one, which I feel like most people don't really think of all the time, because they kind of think, well, men can father children at any age, but in advanced paternal age, so 10 to 20% of male infertility can be tied to the paternal age, so being over the age of 50. So up until, peak male fertility is between 20s and 30s. And then when you get into 40 years of age, the rate of fertility can reduce by about 7% per year, and then kind of drastically after 50%. And even if the male partner does father a child after the age of 50, there can be more health issues in the offspring. So higher rates of breast cancer, learning disorders. So it is important to support the male also in preparing to have a child.
Very interesting.
Yeah. Okay, so before we dive into kind of sperm health, what helps sperm health, and the diet and lifestyle factors, I thought we can kind of do Sperm Health 101 and go over the male reproductive system. I'm not going to go into too much detail about the physiology and all the hormones and everything, but I feel like as women, we're very familiar with our ovaries and uterus. We know what they look like. We could probably draw them out. But we don't really see this picture very often. So I want to go over 4 factors specifically that can affect sperm health. So the number 1 is production of sperm. So this is kind of the main reason why men might experience infertility. And now the sperm, or the spermatozoa, which are the actual individual sperm, are produced in the testicles, triggered by testosterone. So it's kind of the simplified version. And then the second thing is transport. So they're made in the testicles, and then they kind of move over to the epidermis, and they mature there, and then they travel through the vas deferens, which is the yellow kind of line through the diagram. And in the vas deferens is when they mix with secretions from the seminal vesicles and the prostate gland before they go into the urethra before ejaculation. So that's kind of the life cycle and what's happening. Now, the life cycle of a sperm or a spermatozoa is actually around 70 days. So keeping that in mind, that any changes we're making, we want to make them 2 to 3 months before we're thinking of having any kids or trying to get pregnant. And then the third thing, which can have a big effect on fertility rates, is the number of sperm in each ejaculation. So in the semen, how much sperm there is. So if it's too low, the likelihood of fertilizing the egg is non-existent, so that won't happen. And then we also need to look at the functionality of the sperm, so morphology, so what the shape of the sperm, making sure that's healthy, making sure they're moving enough, so motility is enough. And this is important so that it can actually reach the egg and penetrate it. So that's that one. So here's a close-up look at a spermatozoa, so an individual sperm. So when I'm talking about morphology, or like the shape of a sperm, it's kind of divided into 3 areas. So the head, the neck, and the tail. So there's different things that can happen. They'll actually, when they're doing a sperm analysis, they'll actually look at it under a microscope and see, is the head too big, too small, elongated, is there parts missing? This is all really important for fertility. Neck, is it bent? Is it too thin, too thick? Is it asymmetrical? And then they'll look at the tail. These are all important in how it moves and what it's shaped like. Okay. So now that we kind of went through the life cycle, we know what it looks like in general. Let's go over a few, kind of the number 1 test for male fertility would be a semen analysis. So the male partner would go into a clinic, provide a sample, and then it would be analyzed, and there'd be different measurements that will come out from that analysis. So here are just a couple of them. So when it comes to volume, so that's the actual amount of the ejaculate, it needs to be enough. So it needs to be above 1.5 milliliters, which isn't a ton, but there needs to be more than that. And then the sperm concentration and morphology, which have two little stars beside them, these ones are kind of the most important ones, and they're associated with time to pregnancy. So you really want to focus on those ones along with everything else. And the sperm concentration, so that's kind of the same thing as the number. So it's how many sperm per milliliter of semen. So you want it to be above 15 million. Now the range is really wide for fertile men. So it could be anywhere from 15 to 200 and over million per milliliter. The average is about 20 to 40 million. So being in that range is good. With morphology, so that's the shape, you want at least 4% of the shape to be normal. Now it's interesting that if you compare it versus 1987, you see the numbers were all much higher. So the actual quality and the measurements and the averages of a lot of these parameters over the years have gone down. So sperm health has gone down and decreased a lot over the years. So this is, even though the average now is to be above 4% for the shape to be normal, we really want it to be above 50 or as high as it can be. So it's not about just meeting the cutoff, it's about making sure it's optimal. Total sperm motility. So again, you want at least 40% of the sperm in the sample to be moving. And then vitality, you want more than half to be alive. So they're moving and they're functioning properly. Now, the red flags would be if any of the measurements are, under those numbers, we'd really need to look for further causes. Is there, do more investigating, see if there's an underlying cause that could be causing that needs to be corrected, as opposed to just optimizing the results.
This is really interesting, these numbers here, Melissa. Like, it's crazy that if you've got 4% normal sperm, it's considered a normal semen analysis. Like, that is bananas to me. It's also crazy that in 23 years, we went from 50% to 4%. Like, that is crazy. And I guess it highlights the importance of like looking into your results. So like getting another set of eyes. So because you can do a semen analysis like through your family doctor or even like almost directly through a lab right now and just get the results, and they're all going to say normal, but they're not necessarily optimal. So definitely like a good reason to maybe consult with you, bring in your results and get you to take a look at them, because like normal is not optimal.
Yeah, and the average now, it's just the average. It's the average. It's not, the optimal level. Yeah, it's crazy. It's crazy. And what is it tied to lifestyle, diet? Not sure, but yeah, it's over the years. It's just been decreasing and decreasing.
Yeah,
so,
that's wild.
Super interesting.
Crazy. Okay.
So if you've done kind of the gold standard semen analysis test for male fertility, and either if it comes back abnormal, keeping in mind that those numbers are fluctuating all the time for men based on kind of certain factors that we're going to go over. So you need to repeat it again 3 months later, at least 3 months later. And the best way to do it would to actually be to get multiple samples at the same lab over like a week or so and measure them all and to kind of take the average versus just one. A lot of men, it's hard to get them to go in once. So I don't know if you'll get them to go in 3 times in a week, but if it comes back normal, we usually just kind of leave it and we can kind of look at other tests. But if it's abnormal, you need to repeat it. And then definitely maybe do some further testing. So other tests can be looking at serum hormones. So testosterone, which is kind of the trigger for sperm production. Thyroid imbalances can affect sperm health, excess estrogen, excess cortisol. So testing for those, ruling out underlying causes. So when it comes to systemic illnesses, diabetes, so type 2 diabetes, if blood sugar is high, that can cause inflammation and affect sperm health. Hepatic conditions, so liver conditions can also be tied to reduced male fertility, and celiac disease. So if there's underlying autoimmunity happening, that can also negatively affect sperm health. And sometimes with celiac disease, there isn't always digestive symptoms. So it can definitely go undiagnosed. And I find maybe even more so in men, because men are the ones that can kind of have digestive symptoms and just not say anything and just kind of, have diarrhea or be bloated all the time and they don't say anything. So these are things that should be screened if infertility is a concern and you want to investigate that further. So you can do it with a naturopathic doctor. So a lot of people maybe don't know that naturopaths can requisition blood work just like your family doctor. The only difference is it's not covered under OHIP, but we can still do the same diagnostic tests. But depending on where you are in your fertility journey, you may already be working with a fertility clinic and they can do that testing also. And another important test to do, which is interesting for men because screening for sexually transmitted infections can be important. You do this with your medical doctor. Now, it's funny because with women, we get a PAP every 3 years. That's the screening guidelines. And usually when that happens, we also get screened for STIs. So, but men don't have any guidelines like that for screening. So it's really on them to approach their doctor and to get tested. And if they've never been tested, it's sometimes a good thing to do because some of the STIs, for example, chlamydia can go without symptoms in the woman and she could have it and that can cause infertility down the road. So do it for themselves, but also for their partner. Because if during pregnancy, if a woman were to get an STI, that can have very serious effects for her health and the baby's health. Mm-hmm. So that's kind of the other test that you'd want to do. So looking into the treatment, so the optimal diet for male fertility to help boost it. Now diet is included with all the other lifestyle ones and they're called modifiable risk factors. So these are things that you have control over that you can change that can affect fertility. So the best diet is kind of a Mediterranean type diet. So like a whole food, no processed food. Some meat is fine, but mostly plants. So a lot of vegetables, whole grains like quinoa, brown rice, poultry, you can have some fruit. So everyone knows kind of what that diet looks like. And then focusing in on two specific things. So a lot of healthy fats have been shown to be really beneficial for male fertility. They're anti-inflammatory, which is really important just for health in general. So wild salmon, nuts and seeds, avocado oil, and trying to get them with every meal. Because a lot of people are kind of, well, how much do I need? What servings? Just every single time you sit down to eat, trying to make sure on your plate there's something that is a healthy fat. Fermented foods. So there's more and more research coming out about gut health and how it can affect male fertility and just pregnancy in general. So they're saying that maybe gut microbiome maybe affects semen flora, which can affect vaginal flora, and then again the mom and the baby. So it's not just the mom that should be taking a probiotic. Maybe the dad should also, or eating more fermented foods like kimchi and sauerkraut. And then things to avoid, so inflammatory type foods. There is research that trans fats can actually negatively impact sperm parameters, and it is inflammatory, so we want to avoid it. So that's anything like coffee creamers, microwave popcorn, frozen dinners, baked goods, shortening, that type of food. Limiting soy. So soy can be beneficial for women for estrogen, phytoestrogens, and imbalance in hormones. But you actually want to limit soy with men. So not that they can't have it, but you don't want to have it in excess because the xenoestrogens in soy, in dairy, and in red meat can have a negative effect on their hormones and affect sperm health. So we want to limit that. And then a gluten-free diet or avoiding gluten if celiac. So this one I actually found, I didn't know about this beforehand, but I think it's pretty interesting that one of the modifiable risk factors is timing. So actually, if you go without ejaculation or the male goes without ejaculation for more than 2 to 3 days, especially more than 5 days, it can negatively impact sperm parameters. So motility, morphology, the shape, and the count can all decrease. So regular intercourse is healthy and beneficial for sperm health. And again, if you go without it for too long, it can actually result in lower pregnancy rates. So the optimal way would be to be having intercourse every 1 to 2 days, maybe every 2 days if you had a semen analysis and the volume was lower. So you don't want to do it every day, but maybe every second day, starting after the woman has her period. So in the first half of her cycle, the follicular phase, until about halfway through. So when she ovulates. So you'd want to do it every 1 to 2 days, and that's kind of the timing. And a little note that when it comes to male fertility and sperm health, lubricants, especially like KY, Replens, can actually stop stop it from traveling through the vaginal canal and actually reaching the egg by about 60 to 100% in some cases. So making sure if you're going to use it, using other ones like Yes Baby, Pre-Seed, they're available in Canada and they have no negative effects seen for fertility. You can also use like mineral oil or coconut or canola oil, and you want to avoid olive oil, even though it's beneficial for everything else related to health. You don't want to use olive oil or saliva because it can throw off your pH.
One note about the lubricant. So Yes Baby is amazing. I love Yes Baby. They have a number of different products. So the oil-based one is really great when you're not using condoms. It's also really great if there's like, if women find that they're a little bit drier. So it's a really wonderful lubricant, and you can order it like now in Toronto, Whole Foods carries it, the Big Carrot carry it. A lot of places carry it, but you can also order it online. I don't love Pre-Seed as much. And there's another one that is like, it's gone out of my brain right now, the other popular one. The issue with them is if you look at the ingredients, they have parabens and there's another chemical that's in them that isn't really an optimal thing to be kind of inserting into the vagina. But Yes Baby is wonderful. Or the other mineral oil and stuff that that Mel recommended. But if you look at the research, Pre-Seed has done quite a bit of research, and the rates of fertility are actually quite good. I just don't think that some of those chemicals are like awesome to be.
That's fair. That's good. I didn't know that. So you want it to be super clean. I was just looking at the research behind that. It was
totally, which is no, totally. I did a deep dive on lubricants a couple of years ago for a patient and was like shocked what I found. So Yes Baby was like more or less the only one at that time on the market that that I thought was great.
Good. Okay. So Yes Baby then. Okay, so here are some other lifestyle factors, also called reproductive hazards, as per the CDC actually labeled these as that. And so these are substances that can affect the ability to have healthy children for male fertility. So heat is a big one. So if the scrotum gets too hot, can affect sperm production. So hot tubs, saunas, seat warmers in the winter in your car, which men always never want to give that one up. Hot showers. So trying to avoid that as much as possible. Alcohol is a really big one. So alcohol in excessive amounts. So you want to moderate to excessive amounts can lower testosterone, cause erectile dysfunction, decrease sperm production. It can also inhibit the liver from processing vitamin A, which is really important for sperm health also. It depletes certain nutrients like folic acid, which is something that's really important for male fertility also. And now when it comes to alcohol, none is best. So abstinence if you can. And again, with these things, you want to do this 2 to 3 months before starting to try. So if you're not going to abstain, then trying to do it maybe on the weekends. And even Canada's low risk guide for alcohol says for men, no more than 15 drinks per week and no more than 3 drinks per night. That is still a lot of alcohol. So you'd want to do way less than that. Another one is cannabis, marijuana. So THC, it's getting more and more popular, but it interferes with testosterone production, can cause decreased sperm production, motility, and sexual desire. So we don't want to use this all the time. You want to avoid it. It can also, depending on the source, be laced with certain chemicals like lead, which is very detrimental to sperm health. And keeping in mind that it can stay in your body for up to 2 weeks, even after one use, because it is fat soluble. So wanting to avoid it for as long as possible beforehand would be good. Tobacco. So smoking is one of the most damaging risk factors when it comes to sperm health. It can decrease all the parameters, decrease testosterone production, and even secondhand smoke can be bad. It can also, if the male partner is smoking during IVF cycles, can reduce the success rate of IVF cycles. So again, we want to really limit or quit smoking if we can. And then other hazards are more in the workplace. So it's really important to screen not just diet and lifestyle, but what you're doing during the day. Welding has been shown to alter sperm parameters. Military radar, so if again, someone's in that type of line of work, can lower the number of sperm. Lead can lower the number, abnormal shape, and altered hormone levels. So screening for these things can be important and changing them as much as you can.
When I learned this, I thought this was so interesting because like women know that like ideally you don't drink or you don't drink much alcohol when you're definitely when you're pregnant and then also when you're trying to conceive. But I feel like men have no idea about this. Like even my husband, who before we had our first child was like a regular young man who drank frequently. And yeah, it was like a big eye opener for him as well too. So yeah, very cool. So no booze, no dope, no smoking, limited heat, and check your workplace environment.
Yes, lots of things you
Yeah.
do.
Hint, this would be a good thing to remember.
Yes, take a memory shot of that slide. Okay, so one of the last ones in terms of lifestyle and kind of the modifiable risk factors for the most part is stress. So stress with men, and specifically, I find they kind of experience it differently in that they'll experience it, but they don't say anything. Sorry. I'm not used to talking this much because I'm at home all the time. Anybody. So with stress, they'll experience it, but they kind of keep it internalized and they don't really say anything. So the stress response system can be triggered. You know, you can be under stress from psychological things, which a lot of people think of first. So work is really busy, deadlines, family, emotional stress, but physical stress is something that I think men, we really need to remember. So if they're training for marathons, half marathons, if they're going hard into CrossFit, if they're injured from some type of exercise. So an injury, an illness, endurance sports are all stress. So your body doesn't really know the difference between an emotional stress and a physical stress. So that can cause elevated cortisol, which can interfere with testosterone production, reduce sperm count. And then chronic stress, which can negatively affect male fertility, can also lead to increased weight, which that by itself can negatively affect sperm health, and also poor lifestyle habits. So then they maybe start drinking more, pick up smoking, eating more fast food. So it's just it's really important to address stress before kind of everything else when it comes to male fertility. So supplements. So we've kind of looked at diet and lifestyle. What are some extra things we can add in? When it comes to using natural health products for male fertility and sperm health, I think there's a lot of them that have been studied and have really good research behind them. But the kind of general idea why we use them is one, to help prevent deficiencies. So if we're not getting enough nutrients from our diet, which most of the time we're not, just because soils are depleted, we're not getting enough from it, digestion might be compromised. So to prevent deficiencies, also a lot of them are really strong antioxidants, which are really important and anti-inflammatory for men's health. So overall, they're kind of for that. They're also for energy production, supporting energy production so that your body can make hormones and so that your body can make sperm. So that's kind of the idea behind it. Now here's a few of them in general. So folic acid is really important for male fertility. We already know it's important for female fertility in preventing neural tube defects. It's actually been shown that it helps with sperm concentrations. And even when they added zinc, it also helped with sperm morphology. So keeping that in mind, and the dose is actually much higher for men. So it's not just, you can't just take your woman's folic acid or something like that. You'd want to do a little bit more. Selenium and N-acetylcysteine are really important antioxidants, and they help with all sperm parameters related to semen analysis. Probiotics, again, going back to gut health, and then omega-3s. So they act in different ways, but both of them have been shown to help with volume, how much sperm are moving, and the shape of sperm. So there's so many other ones. There's CoQ10, vitamin D is very important. And with vitamin D, we want to test levels first, because we want to know, even though most people are low in it, we want to know how low, because you don't want to take too much, because you can overdo it with vitamin D. Melatonin has been shown to be beneficial if men are not sleeping properly, and for certain types of male infertility, it can be beneficial. Vitamin C and vitamin E are really good. So it's really important to know which supplement to take, and not just kind of take all of them at once just to be preventative. So I think basing it off of kind of a semen analysis and seeing what the results say, that's kind of how you would guide what supplement to use, apart from like a multivitamin.
So bottom line is there's lots of options for supplements for sperm health. Book a discovery call with Melissa, and she will go through and see what your sperm donor / baby daddy to be might need or might not need, because they might not need any, or they might need all. So yeah, talk to Melissa about that.
Totally. So then I just wanted to highlight this. So this was a study that came out in April of this year. And it actually went over, it was kind of a combination of a bunch of different vitamins and minerals and antioxidants. And it did show it helped with increasing the percentage of men with normal standard sperm parameters, and increased the number of vitality, so the sperms that were alive. So it's just showing that the research is still going on, and it's still showing that it's beneficial.
Amazing.
Yeah.
I haven't seen that study yet.
Okay, so how does naturopathic medicine fall into male fertility and fertility treatments? So it's really important, even if you are working with a fertility clinic, they're great at doing a workup and diagnostics and the treatments for it. But it's also important to assess diet and lifestyle, and to treat those and know what supplements to take, because some might be detrimental. So making sure you're taking the right ones. And we can also help if we're just doing more of a preventative or just trying to optimize men's health and male fertility, identifying and treating underlying factors. So just running some general blood work and making sure everything is in order, and that diet and lifestyle is good. There's nothing we need to change. If they do want to make changes like quitting smoking cessation, there's good research behind certain supplements that can help with it, and acupuncture protocols can be really beneficial. So in that way, helping with weight loss and energy increase, these are all really important things that can help also.
Awesome.
So you are helping optimize male fertility, but then it doesn't just kind of stop once the woman gets pregnant and then we leave it. So all through that, we really still need to keep supporting men's health, even once the baby's born. So there was so Movember actually commissioned a survey, and it was across the UK, Canada, in Australia in May of last year, and there was 4,000 men. More than half of them were new dads, and 7 out of 10 of the fathers said that their stress levels increased in the first 12 months after they became a first-time father. So this is important because it went up, and they also said that the hardest thing for them to talk about was their mental health. So we don't want them, on the side struggling and not saying anything, and this affecting their health, because then that affects, they can't help the mom or the partner as much, and then it affects the whole family. So we really want them to be as healthy as possible. And also the thing that helped them the most was staying socially connected and their friendships, which this time with social distancing, it can be really important. We really need to stress and let them keep their connections and encourage them to do that. And also making sure, they're sleeping properly, mom and dad. So scheduling time for that. Maybe mom goes to bed earlier, and then dad stays up with the baby, and then mom gets up, so that making sure that both partners are getting enough sleep. And maybe Dr. Ashton can speak more to this with 2 at home and 1 on the way.
Sure. Can I go to the next slide just to
Yep.
have that outline speaking? Okay, great. So this is my hubby, Jake. Jake is wearing a dad shirt, which this is what I gave him as his push present, which I thought was hilarious. He did not give me a push present. I'd like to put that on the record, that he was the only one that received a gift at the birth. And so this shirt was life-changing for us. So Frankie was one of those babies that just loved to be held, all the time, day and night. And so it was a lot. It was also our first baby. We had very little idea what we were doing, and also not a ton of not like we both of our parents were quite helpful, but not like a live-in kind of support. And so yeah, this shirt and having a really great carrier for the baby was amazing for me. So Jake's always an early riser, so he would wake up early and then take the baby, whether she was like sleeping on me in bed or in her bassinet, like the one night she might have done that in the early days. He would take her and like go for a walk outside, or like wear her in that shirt and make breakfast or something like that and give me a break. And it was so awesome. So when maybe some dads to be are watching this later, this is so great to like take baby and give mom a break. And I would say that stat of like 70% of men felt more stressed after having a baby. I would say like 100% of engaged fathers would feel more stressed after having a baby. And not even stress in the terms of a negative sense, but just like the balance of your life. So you might be working, and then now you're also, there's like the added pressure of like, oh, I want to get home to spend time with the baby before the baby goes to bed. And then still trying to like maintain social connections and all of those things. So like definitely very important to have like a really open dialogue with your partner, setting up some sort of schedule as well too. But yeah, this dad shirt was amazing. Finn never fit in it. He was too big, so he had to go in the carrier. But yeah, I just thought it was like the cutest thing, and she loved it.
Thank you.
All right.
Good idea. Yeah, so overall, I think it's important to address male fertility, men's health, but kind of look at fertility as a window to long-term health. So you're kind of setting them up for the future and not just for right now. And remembering that fertility is just, it's an important piece to the puzzle when it comes to pregnancy. But I find when it comes to men's health, this is great knowing all these things and getting them in and getting tested. But the main obstacle with men, as per the fact that this is all women that tuned in for the webinar, is getting them into the door. So Cleveland Clinic, I like surveys. I like to see what the actual numbers are. They did a men shouldn't survey in 2017, and there's a lot of men that answered it. But 72% of men would rather do household chores like cleaning the bathroom than go to the doctors. 77% said they would rather go shopping with their partner and spend the whole day at the mall than go to the doctors. So this is really interesting, and it highlights something that yeah, they're just really not wanting to go. And in that survey, they also said that more than about half of them are embarrassed to talk to their doctor about certain health issues. That it's really interesting. I don't know if it speaks to the generation that answered or just men in general, but around 40% were told as children that talking about health issues was seen as weak. So, you know, you don't want to talk about health issues, so maybe that's why. And that around 30% of them didn't want to go to the doctors because they didn't want someone to tell them that they had to change their diet or their lifestyle. So that really speaks to also small changes and just little things, keeping it manageable so that, you know, like Ashlyn said, they might not be willing to do changes and they a little bit lazy and you need to push them. But if you make it as convenient as possible, so video consults or, you know, going in with them or something like that, that's when they're more likely to go. But the survey also said that, and I think speaks to most men, they try to stay healthy for their loved ones as much as they think they're trying, even though only about half of them were actually doing things to try to do that, but they want to. So it's just about kind of giving them a little push and making it convenient. But yeah, so that's men's health.
And it can also be just like little changes. So like we're talking about, okay, this is the research, this is like best case scenario. But if you're like, oh my God, my partner smokes and he drinks like a fish and like all of these things, like realistically, like and maybe he is, but like probably he's not going to like quit smoking, quit drinking, quit like using marijuana, whatever, in a really short period of time. But even if we can make some small changes and like maybe reduce the amount he's smoking, or get him on some supplements to help optimize sperm health in another way, something like that, there's always an improvement that we can make. Yeah. So just meeting men where they're at.
Exactly.
So yeah, so these are some of our Instagram poll questions. So I'll read the question for you, Mel, and then you can go for it.
Sure.
Okay, so first question is, how likely is varicocele to affect male fertility? How can one increase the likelihood of success, I assume, with fertility if they've had one?
So really good question. So
And
I didn't.
actually, sorry, let me interrupt for 1 second.
Yeah.
Some of these questions, a lot of them are general, which is great. This one is like kind of pretty specific.
Yeah.
So hopefully the person that sent me this question is on the webinar, and definitely book in for a discovery call with Melissa. So yeah, sorry. Now go ahead and answer.
So yeah, this is a really good question. When I saw it, it's really good. So I didn't put a slide on it, but this is actually one of the top reasons for male infertility and can play a role in male infertility. Now, how likely is varicocele to affect male fertility? We don't really know that exact number, because 2/3 of men with varicocele did retain their fertility. So it's not just because you have it means you won't be fertile. And it also depends on the grade. So there's a grade and severity of how severe it can be. So this is on diagnosis, as they would figure that out. And how long you've had it can also play into how it affects your fertility. Now, how it can negatively affect fertility is that it increases the testicular temperature, which we know heat isn't good. Pressure, it decreases blood flow. So you're not getting as enough nutrients. But a really big one is that it causes more oxidative stress in the testicles, which can, again, negatively affect sperm production. But one of the good things is that there's a few studies that do show that even if you have varicocele and you don't get it surgically repaired, because some of the research on repairing it surgically doesn't necessarily mean it's going to improve fertility markers. But when they supplemented with antioxidant supplements, it benefited the sperm parameters, and also showed it might help with pregnancy outcomes. So you can supplement. That's kind of the short answer.
Great. So does biking, in particular road biking long distances, affect sperm?
So yes, it does. There's studies on this. So even kind of low intensity, long-term biking. So they did a study, it was 16 weeks of low intensity training. Now this is a long time, but most men, if they're bikers, are biking consistently all the time, or if they're commuting on a bike a lot, it caused inflammation, increased inflammation, and decreased sperm parameters, all parameters. And the interesting thing was that in the studies, this effect lasted more than 30 days after they stopped biking. So yes, it can. And if you do want to stop biking, you'd want to stop far enough before, not just right before you start trying.
So like that 70-day window type thing.
Yeah, that would be best.
What are non-fertility clinic options if you have been told you have poor sperm?
Naturopathic medicine. So just for the reasons of trying to look at if you said you've had poor sperm, probably because you had a semen analysis, and we can look at the numbers, know how to interpret it properly, and then try to kind of tailor your diet and lifestyle and supplements to benefit it. So if it's just kind of like trying to optimize, I think that's good. If it's really, really poor, then yes, involving kind of other healthcare practitioners is also good. It's best if you're seeing naturopaths plus medical doctors, fertility clinics, everyone's kind of has their eyes on you. It's probably best, but yes, naturopathic medicine can help for sure.
Amazing. We've kind of talked about this, but we'll just like reiterate. Does alcohol intake affect sperm? Do I need to quit drinking? If yes, for how long?
Yes, definitely does. So I'll go over kind of why again. So it does lower testosterone, affects sperm shape, so the morphology. The big one, I think, is it inhibits the nutrients, so like vitamin A, folic acid. So it's kind of doing a lot of negative things. So yes, you'd want to quit drinking. no amount is the safest amount possible. So trying to abstain for 2 to 3 months before.
Awesome. Does underwear choice affect fertility?
This is a funny question. So when I first read it, I was like, well, of course it does. We all know, boxers are better. But I think I should look into this a little bit further. So there was a study in 2016 that included 500 couples, and they found no difference between boxers or briefs. That's one thing. And then there was this another study 2 years later in 2018 that did find that men who wore boxers had about 17% more sperm count. But the thing is, they didn't really look at like underwear material. So sometimes cotton is more breathable, so there's not as much heat that's built if you're wearing briefs. So I think the overall answer is wear what's comfortable. If you do like boxers, maybe wear boxers.
Got it. And last one, if you have had one kid but are having problems getting pregnant the second time, could it be my husband's sperm or is it probably my issue?
So this is a loaded question, I feel like. So when it comes to kind of secondary infertility or like with the second child, a lot of questions. So like number one is how long have you been trying? Because even though it's a second child, it can still take 6 to 12 months. If it's only been 2 months, that's normal. So there's no issue with either partner on that front. But then when it comes to kind of general infertility, lifestyles could have changed for the male or the female. So that can affect sperm health and fertility rates. So, and we do know that both partners can play kind of an equal role. So it'd be good to have a semen analysis if concerned about that, and then to assess both partners' diet and lifestyle and address both, because we need more info to see. And even if infertility is a diagnosis or something like that, we never really know, is it just the male or the female? But addressing both is super important.
And every pregnancy can be totally different. So I have patients that really struggle to get pregnant the first time and they might need IVF or something like that, and then have like an accidental pregnancy round 2. So things can change drastically as well too, from like child to child. So it can, I totally agree with Melissa. It can be any number of issues, but yeah, definitely talk to, if you're concerned at all, I would talk to your naturopathic doctor or medical doctor or whoever is caring for you. All right. Okay. Any other questions? I'm going to stop my share just for 1 second here. Okay. Take a look at the chat. Okay, I don't see anything, but the Q&A I think is private. So let me go have a quick look in the Q&A. Okay, great. So if you do have any other questions, feel free. Sorry, let me go back to, oh my goodness. Here we go. Let me go back to screen sharing here for a second. Okay, so if you have any questions, feel free to pop them in and we can definitely answer it for you. So what we're gonna do is Melissa is going to say a question, and then whoever is the first person to put the right answer, ideally in the chat. The last webinar, there was a bit of issues between like the Q&A and the chat. And so try to put it in like the communal chat. Whoever is the first person to put it in there, I will either mail you or drop off, depending where you live, our favorite male fertility supplement. So neither Dr. Melissa and I work for any supplement companies. We have no affiliation with any of the companies. There are lots that we love. And so the supplement that we really like is called Male Fertility Sap by NFH. And it's just a really great comprehensive supplement. It has a lot of the nutrients in there that Dr. Melissa was talking about. And it's also pretty pricey. So it's a great thing to win. So I'm just going to stop my screen share for 1 second so that I can see the chat while Mel, okay, go for it. We're ready for you.
Here's the question. So name 3 reproductive hazards, i.e. Lifestyle or diet factors that can negatively affect sperm health. So name 3.
Whoa, Jenny is all over this. Okay, heated seat, hot shower, smoking. I think those are all correct.
They're correct.
That was like, I don't even know how you typed that fast, Jenny. You deserve that. Amazing. Okay. I have your email, Jenny, so I will send you an email after this and I'll figure out how we're going to get it to you. But that's exciting. Okay. I'm gonna go back to our screen share for 1 second. Okay. Great. Okay. So as we mentioned, I'm gonna send an email out after this. So you will get an invite to join Flourish Females. We're gonna send you the recorded webinar. So if you're, whoever is providing the sperm for you for your next baby is not listening, which I know you're not, because unless you're listening maybe with your partner. So that way you can maybe have them watch it, especially if they don't believe you for some of the things like the drinking and the smoking and the what have you. So we're going to send you a recording of it. Please do book a discovery call with Dr. Melissa, especially if you have specific questions, because she is a wealth of knowledge for men's health. So she's definitely like a wonderful person to talk to. And then congratulations, Jenny, on your supplement, the male fertility set. I'll leave Melissa's references up and you'll get this so you can always take a look at it later. But if there's no further questions, thank you so much, Melissa, for doing this. I'm so excited to have Mel on the Flourish team. And yeah, have a wonderful night, everyone. I hope that you have a great plan for your long weekend. I'm sure it probably doesn't involve what it did last summer, but that's okay. It'll be great either way. Okay, bye guys. Thanks so much. Bye, Mel.